Good morning. Today we will be discussing the cardiac system. This system is a very important system for many reasons. First, I would begin by saying, please review the blood flow through the cardiac muscle before beginning this lecture. Now, I would like to start with some common cardiac terms. I would like for you to give me the answer, please. This is the amount of blood returning to the heart. Preload. Preload is the amount of blood returning to the heart. Now, this is the amount of pressure in the aorta and the peripheral arteries that the left ventricle has to pump against to get the blood out. It's the resistance. It is called afterload. Afterload is the resistance that the left ventricle must pump against to get the blood out into the system. Now, this is the amount of blood pumped out of the ventricles with each beat. Stroke volume. The stroke volume is the amount of blood pumped out of the ventricle with each beat. What is the formula for cardiac output? That's right. Heart rate times stroke volume. Now, our tissue perfusion is dependent on the cardiac output, correct? Now, the cardiac output changes according to the body's needs. Factors that can affect the cardiac output could be like a decrease or increase in the heart rate. Remember, cardiac output equals heart rate times stroke volume. Now, the amount of blood volume that is put out, stroke volume, okay? Decreased contractility could also have an effect on the cardiac output. For instance, if you have a myocardial infarction or some sort of muscle disease, this is actually going to affect the contractility of the heart, and it's not going to be able to put out as much as we would like. Now, if your cardiac output is decreased, will you perfuse your organs properly? No. The level of consciousness in your brain will go down. Your client will complain of chest pain, heart not receiving enough oxygen. The lungs will be short of breath. You might hear crackles and wet sounds. The skin clammy. The urine output goes down, and the peripheral pulses are weaker. That's correct. Now, you will have arrhythmias, but can I please let you know that arrhythmias are really not a big deal unless they affect your cardiac output. Especially if there's no cardiac output, like VFib, VTach, and asystole. When I told you about the brain and the level of consciousness, the urine output, the heart, the peripheral pulses, now those are a way for you as the nurse to assess cardiac output. If those things are within normal range, then we can assume our patient is experiencing a good cardiac output. Now, let's talk about chronic stable angina. Now, this is a type of pain where we are exerting ourselves. Our heart muscle requires more oxygen. For some reason, usually coronary disease, we are not able to get enough oxygen to that part of our heart in time. Our heart begins to hurt. Now, this can usually be predicted. Our heart is in a reversible state at this time. Yes, we are experiencing ischemia, but no necrosis here. This situation, like I said, is reversible and is usually relieved with rest and nitroglycerin. For instance, if you know that you have chronic angina pain and you go to cut your front yard with a push mower, you can actually precipitate heart hurt and go ahead and take nitroglycerin prophylactically. Rest and nitro relieve pain, and this is lack of oxygen due to exertion, usually caused by coronary artery disease, and it does cause ischemia, however, not necrosis. It's a pain and pressure in the chest. Now, like I mentioned, the medications are going to be nitroglycerin as the first symptoms come on. Now, the reason why we would like to administer nitroglycerin is because it actually dilates the veins and the arteries. This actually causes a decrease in your afterload. It also causes dilation of the coronary arteries, which allows more blood flow to actually get to your heart muscle. Now, nitroglycerin should be instructed to your patients to take 5 minutes apart with 3 doses sublingually. Now that's under the tongue. It's not okay to swallow these. They do need to be taken under the tongue. They need to be kept in a dark glass bottle, not on a windowsill. It needs to stay away from the sunlight and the bright lights. Now, sometimes when you take nitroglycerin, they might fizz in your mouth, and that is okay. The patient doesn't have to be anything to bring this pain on. Matter of fact, they could be waking up from sleep having